111 is a new number. It's being introduced to both take the pressure off 999 services and also to replace the 0845 number that at the moment NHS Direct uses. The idea is it's a single point of access, so if you don't know what to do around something that's happened, an accident, a piece of health advice, etc., then you can ring 111 and they will put you through to the right service.
GP commissioning groups, the groups that are planning healthcare that don't actually have any legal basis yet, are being told that they must arrange the emergency service, the new urgent care service called NHS 111 now, although the service doesn't actually start till April 2013. And these groups are nowhere near ready to arrange anything, certainly not an urgent care service. We would like the Secretary of State to wait a bit, to allow these commissioning groups, these GP-led organisations, to get going, and then to arrange urgent care for the patients in their areas.
There are 4 pilot sites running in Luton, in Lincoln, in Nottingham and in Durham, and we're still getting the results back from the evaluation that's been done of those pilots. So the issue at the moment is how fast you roll out the service across the rest of the UK while you're waiting for the results from the pilots.
The main problem with the pilots is that they're using lay people with computer programs to decide whether someone is ill or not, rather than passing the calls to a doctor or a nurse to assess the situation. Now, we know that some of the pilot sites actually want to do that, and indeed there's no reason why they couldn't, but the pilots have not really done that very well. And so we want patients to be assessed by a doctor rather than by a lay person. We don't think that's particularly safe, although many of the calls it won't matter terribly much, but for some of them it will. And so we need to be sure that these systems are clinically safe and reliable.
It's important we learn from the evaluation of the pilots. And at the moment, some services are being procured across large areas of England without that knowledge, that absolute knowledge from the pilots. That's why I think the BMA and we would be saying, why don't we wait with the procurement until we've got more answers?
This isn't personal. This is an idea that's been talked about by various political parties. It's actually an idea that doctors are quite content with. We actually want to make it work, and we think it can work, and we hope he'll listen. This isn't a political dig. This is something that we want to get right. This is an urgent care service, and patients deserve the best they can possibly get.